Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers. Today, a new public health school is set to open in Detroit. Dr. Bernard Costello is the Senior Vice President for Health Affairs at Wayne State University. He joins Dr. Josh Sharfstein to talk about how the university's brand new public health school builds on a long tradition of community-engaged work. He's also quite bullish on the job prospects for future public health graduates. Let's listen.
Dr. Bernard Costello, thank you so much for joining me today on Public Health on Call. It was great to meet not too long ago in Detroit, Michigan, where Wayne State University is located. And you told me about your plans to develop a school of public health, and I'm excited to talk about them. How's your day going so far?
Great. I've had a whole bunch of online meetings, as is per typical, some in person, but today's largely online. So happy to be with you, Josh.
So before we get into the School of Public Health, tell me and tell our listeners a little bit more about Wayne State.
Yeah, so Wayne State University is one of the three R1 comprehensive public universities in the state of Michigan. And it is about 24,000 students. It has a full complement of health sciences, which is the area that I oversee, medical school, college of nursing, Applebaum pharmacy and health sciences school, and this new emerging School of Public Health that we're putting together. It's focused in an urban setting of Detroit. It's a area that has a lot of first-generation students. The majority of our students are first-generation students, and it's been serving the state of Michigan since 1868.
Wow. And how long have you been at Wayne State?
Just about 15 months. So I came from Pittsburgh. I was at the University of Pittsburgh Medical Center and the University of Pittsburgh for almost 25 years. Before this opportunity came up, which was really mission-focused and pushed a lot of good buttons for me.
What surprised you or impressed you about Wayne State since you've arrived?
Probably the most impressive thing for me relates a little bit to our discussion today, which is that Wayne State University has been embedded in this community in an urban setting and in Midtown Detroit. Like I said, since 1868, it started as a medical school. And for that reason, it was really started to be for the people, work with the people of Detroit, and be in Detroit as a major fixture, as a partner. And its community-engaged facing research platform is one of the most dynamic and trust-built partnerships that I've seen in the country. We did great work at the University of Pittsburgh. There's a whole focus on community engagement and community-engaged scholarship for here at Wayne State. It's incredibly reflexive. It is something that has come naturally after decades and decades of trust building and partnership with the community that includes health research, particularly public health research.
So can you give me an example of some of those collaborations that you came across since starting at Wayne State 15 months ago?
Sure. So we have one of the state's two NCI designated cancer institutes and the Karmanos Cancer Institute, which is part of McLaren Health. That's been a long-standing partnership for us and a bright spot for us from a research standpoint. The community-engaged work that some of our practitioners do, such as Dr. Haley Thompson, for example, working with church groups, community-based organizations, others, to help design these clinical trials with the community as partners, not just in mind, not just as advisors, but as true partners in this process, has helped accelerate the improvements in healthcare in this area, whether it's for prostate cancer or for hypertension, for cardiac outcomes. Doesn't even have to be cancer. It is lots and lots of engaged work across our health sciences platform that starts with relationships like that Haley has built with the community.
Which brings us to the idea that Wayne State is going to start a public health school. And I would maybe just venture to say that in 2026, that may not be the first thing that comes to everyone's mind. There's a lot of hand-wringing about the future of public health education, a lot of attacks on public health these days. Walk me through your thought process and the university's thought process to say we should open a new school.
Yeah, it's great. A great question and an important and timely one. I think about public health like insurance. You don't necessarily think about it all the time until you really, really need it. And if I think about, how glued everyone was to their TV with Doctors Fauci and Birx, back in 2020 when we were dealing with COVID-19 and that pandemic, or even the hantavirus, you know, it's not just infectious diseases, but it's all the things that we do that we take for granted: clean water, clean air, how we approach systemic public health problems. These are needs that are ever present. And we need public health to sort of make that happen. And to be clear, while the school will be new as an administrative entity, we're not starting from scratch. We're an organized group of public health activity that already lives in an ecosystem within our university. It's just scattered about in a variety of different schools currently. And what we're doing to amalgamate these things is really create a new ecosystem at the school level that, with the scale, visibility, accountability, and community orientation that we have the capability of doing, we can do amazing things for Detroit, Southeast Michigan, and indeed the nation. This is the kind of platform that I think people that are truly interested in impactful, engaged public health work want to come to. And we have a very large, the largest actually, baccalaureate program and degree completion rate in the state. Same for masters. We do very well in that area. And this is an opportunity to bring those things together. Despite the federal funding challenges around some research areas, we see lots of growth and lots of employability.
I hear you saying the idea really started with the work that Wayne State is already doing in its community, which is essentially public health work. And maybe that's split in different places. You're going to bring it together. But also I hear you saying that you got a lot of interested students. So tell me more about the undergraduates, for example, who might proceed into a school of public health.
Yeah, we've seen growth in that area. So as you know well, being at Hopkins, the PhD market for this type of work is a niche market. We generally create academicians out of that process, people to do very high level research, create new knowledge. But the bachelor's and master's group, those skills, either on their own or coupled to an existing degree, are really high level, highly desirable job needs for the nation. Job growth, as per the Bureau of Labor and Statistics numbers, is expected to be a little bit flat, going forward, but not in public health oriented areas. So for public health case manager work or health manager work in general for health systems, we're looking at 16 to 18% growth over the next 5 to 10 years. For nurse practitioners who have this skill added to their existing portfolio, we see 33+% growth. And particularly in Michigan, it outpaces the need nationally, although the national job market for these types of degrees is pushing almost 300,000 jobs projected. So, these are growth areas which you just don't see in other areas, and you don't see with lots of higher ed degree programs currently at this rate. So we're excited about those possibilities, and we do see a lot of student interest.
That is so interesting. I think people look at challenges in funding health departments at the state, local, or federal levels and think this is maybe a risky career decision to pursue public health training, but you're thinking of the skills more broadly, and you're looking at the economy more broadly, not just governmental public health right now.
Sure. I think you have to, given the fact that healthcare is roughly 19% of GDP in the United States. We can argue whether that's a good thing or a bad thing, but it is a thing. So having folks in a position to be able to help that healthcare system work more effectively, typically within health systems. These are really desirable jobs. The skills that we build in these kinds of actionable degree programs are going to be very helpful. This is not an ivory tower program, that just thinks big thoughts and does research. We do those things. But it is really about having public health be local, how it affects national policy matters, how we execute that in cities and counties and schools and clinics via health systems and other mechanisms, not just in county health departments or city health departments. We'll fill that need, and we do, and we have lots of connections there. But the broader economy really needs these jobs as well, and that's shown in the data.
You've got the mission. You've got the experience, you've got the students, I'm sure you have a bunch of faculty. How do you actually go about starting a public health school?
Yeah, it's quite a project. Some have described it as sort of multiple trains leaving the station, with slightly different destination times. It's a matrixed approach, not just a step-by-step approach. When you do something like this, especially at a university, there's lots of building blocks to put together with respect to faculty and bylaws and contracting. And, we work through those administrative things. But in large part, it's about the excitement of building these degree programs, these concentration areas and areas like environmental health sciences, community health, biostatistics and epidemiology. Those are our major, 3 focus areas. So building the curriculum for the future, even though we have a lot of these programs ongoing, that's sort of the exciting part. That's a big part of building the platform. Of course, we'll hire an inaugural dean. We have a search process in play at this time, which is great. And then also we need to support it with our talent and try to continue to acquire the best talent in this space. And that's another thing that really excites me about Wayne State University is if you know how these folks work and how effective they are at community engaged partnerships and investigation and research in that area, you get excited when you see them do this level of work. It is much easier than in lots of other cities that I've seen because, again, that trust is there. So doing those studies, making changes in public health, it's actually going to translate into real public health improvements in critical areas like diabetes and hypertension and heart disease. That's really exciting. And it's probably most exciting for me about starting a school is the impact.
What do you think that school is going to mean for Detroit, for Michigan, for the country in terms of impact?
Yeah, it's a great question. And it relates to that, why would we do this now question. I think the best organizations really kind of lean in when there's difficulty, when there's pressure. You just have to be creative about how you do it. Detroit has major public health needs, an extraordinary community, civic, academic, and health system assets. We have, a number of different health systems in the area that spread out in a state that is very urban with 5 million people in the metro Detroit area and another 5 million in very rural areas, including the Upper Peninsula. That combination makes it a really ideal place for modern practice-oriented school of public health activity. Life expectancy, for example, it's about 69 for the average male in this area, 76 in the more wealthy counties outside of the Detroit zone. You can make a real difference doing this kind of work here. So that poor health data were the worst or the second worst in a couple, categories nationally. That's an urgent need, but it's also really important work to do. Those are the kinds of things that, we really need to do almost no matter what. As a country with all that's going on, health is primary. It's really an essential aspect of what we do. And thankfully, this kind of, group that already is doing great work, I think can do it even better as a school.
Well, I can sense your enthusiasm. I imagine you're going to be thrilled when those first students come into the program.
Yeah. And I think, for me, it's all of them. We just had graduation. One of the things we do is the president asks the undergraduate students that are graduating at this ceremony to stand up if you're a first-generation student, the first person in your family to get a college degree. And the vast majority of those students stand up at each and every one of these undergraduate baccalaureate ceremonies. And a lot of them focused on public health and community engaged work, which is really, really exciting. So, for us to be able to start this, deal with the public health workforce shortage that's projected by BLS and others, deal with healthcare workforce needs at health systems, and also build leaders for the future that really know what it means to be actionable in this work. That's a really important mission. It's a mission that I'm obviously very excited about, and one that Wayne State, I think, can fulfill in a very unique way.
I totally agree. I think it's tremendous what Wayne State is doing. And as a representative, or at least as a faculty member at the oldest school of public health in the world, I think I can say that I'm thrilled to hear about the continued growth of our field and the thoughtfulness with which you are pursuing it. Thank you so much.
Yeah, the pleasure's mine, Josh. I love the work that Hopkins does. We're always looking to collaborate, so we're open to any and all collaborations as we continue this project.
Excellent. You have my cell phone and we'll be in touch.
That sounds good.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.